Pumpkin seeds are often praised as tiny nutritional powerhouses. They're rich in healthy fats, magnesium, fiber, protein, and antioxidants. Many people add them to snacks, smoothies, and even daily diet routines thinking, if it's natural, it must be safe for everyone. But that's not always true. People with seed or nut allergies need to be extremely cautious with pumpkin seeds because the body's immune system can react aggressively even to small amounts. An allergy happens when the immune system mistakenly treats harmless seed proteins as dangerous invaders and releases chemicals like histamine that trigger symptoms. These reactions can range from mild to life-threatening, and many people underestimate pumpkin seeds simply because they are considered natural or are often labeled as a healthy snack. However, being healthy does not make them automatically safe for everyone, especially for people whose immune systems are sensitive to seeds or nuts. Someone who has previously reacted to sunflower seeds, sesame seeds, peanuts, walnuts, or even pumpkin flesh may be more likely to react to pumpkin seeds as well, because the body can sometimes respond to similar protein structures found in various seeds and nuts. Symptoms can appear quickly after eating, sometimes within minutes, and may include itching in the mouth or throat, swelling of the lips, tongue, or face, hives on the skin, redness, sneezing, runny nose, coughing, or breathing difficulty. In more serious cases, a person can develop anaphylaxis, which is a severe allergic reaction that may cause a drop in blood pressure, difficulty breathing, rapid heartbeat, dizziness, chest tightness, or even loss of consciousness, requiring immediate emergency treatment. This is why people with known food allergies are often advised to read ingredient labels carefully, avoid trying new seeds without guidance, and carry prescribed emergency medication if recommended by their doctor. But it is not just about obvious eating. Pumpkin seeds can also appear in granola mixes, bakery items, protein bars, health snacks, salads, cereals, trail mixes, and toppings where people may not even notice them. Even cross-contamination can be dangerous, meaning if pumpkin seeds were processed or packaged in the same factory or on the same equipment as other seeds or nuts, traces can still trigger a reaction in highly sensitive individuals. Roasting, cooking, or boiling pumpkin seeds does not remove the allergens because heat does not destroy the proteins that cause allergic reactions, so people should not assume that cooked seeds are safer than raw ones. Some individuals may also experience gastrointestinal reactions like stomach pain, cramps, diarrhea, nausea, or vomiting because the immune reaction can affect the digestive tract as well. Children with existing food allergies are especially vulnerable, and parents must be very careful about what snacks they allow into their diet because even small bites or accidental sharing of snacks at school can be risky. Another important thing to understand is that allergies can develop later in life too. Someone who used to eat pumpkin seeds comfortably in the past may suddenly develop sensitivity after years of no issues, so ignoring unusual symptoms and assuming "this never bothered me before" can be dangerous. Anyone who suspects they reacted to pumpkin seeds should avoid them until they consult a healthcare professional, rather than testing repeatedly on their own. Allergy testing, medical advice, and proper diagnosis are important for safety so that the person clearly knows what to avoid and how to protect themselves in the future. Even if pumpkin seeds are widely promoted for health benefits like heart health, magnesium content, and antioxidants, they are not worth the risk for someone whose immune system treats them as a threat, and caution, awareness, and respect for the body's reaction are always more important than following any food trend. People with digestive issues or sensitive stomachs need to be careful with pumpkin seeds because although they are nutritious, they can be surprisingly hard on the digestive system when a person already struggles with gut-related problems. Pumpkin seeds are high in fiber, and while fiber is generally healthy, it can become irritating when the digestive tract is already inflamed, weak, or overly reactive. Individuals dealing with conditions like irritable bowel syndrome, gastritis, acid reflux, chronic bloating, or inflammatory bowel diseases like Crohn's or ulcerative colitis may notice that pumpkin seeds trigger discomfort rather than benefit. The rough texture and fiber content can lead to cramping, gas formation, abdominal swelling, and even episodes of diarrhea or constipation depending on how the body reacts. When the digestive system is sensitive, it often cannot break down tough seed coats easily, and undigested pieces can cause irritation as they move through the intestines. Many people also eat pumpkin seeds roasted and salted, which makes them even harder and more challenging to digest, aggravating symptoms like burning, heaviness, or stomach pain. Some individuals experience indigestion because the fat content of pumpkin seeds slows the digestive process, meaning food stays in the stomach longer, which can intensify discomfort in people who already have delayed digestion or gastric problems. Those who have had previous intestinal surgeries, narrowing of the intestines, or bowel obstructions are often advised to avoid whole seeds because they can create blockages or worsen existing narrowing due to their size and density. Even people without diagnosed digestive diseases, but who frequently struggle with gas, heaviness, or irregular bowel habits, may notice that pumpkin seeds make their symptoms worse. Chewing also plays an important role. Many people do not chew seeds properly, swallowing them almost whole, and this makes them even more difficult for the stomach and intestines to handle. Sometimes people eat them at night as a snack, and eating heavy or fiber-dense food late can disturb digestion and sleep, leading to nighttime discomfort or acid reflux. For individuals with gastritis or stomach lining inflammation, pumpkin seeds can irritate the already sensitive stomach wall, potentially leading to burning sensations or worsening tenderness. People with IBS often find that seeds and nuts are among their trigger foods because they stimulate bowel movements unpredictably, sometimes causing cramping or urgent bathroom needs shortly after consumption. Another problem is overeating pumpkin seeds because their small size makes it easy to consume a large quantity without realizing it, and when too much fiber suddenly enters the gut, the digestive system reacts strongly with bloating and pain. Some store-bought pumpkin seeds are flavored with spices, seasonings, or oils that further irritate the stomach, especially for people who react badly to spicy or greasy foods. Children or elderly individuals with weaker digestive systems can also experience stomach distress more quickly from these seeds since their bodies are less efficient at handling heavy or difficult to digest foods. People with lactose intolerance, gluten sensitivity, or other digestive sensitivities often have more reactive guts in general, meaning pumpkin seeds can become yet another food that overstimulates their system instead of supporting it. Even though pumpkin seeds are promoted as healthy for the heart, prostate, and overall wellness, digestive comfort should always come first because a food that causes pain, discomfort, or bowel disturbance is not beneficial for that individual regardless of its nutritional value. People with kidney disease need to be especially cautious with pumpkin seeds because their kidneys may not be able to handle the minerals these seeds contain in high amounts. Pumpkin seeds are rich in potassium and phosphorus, which are beneficial for healthy individuals, but in people with compromised kidney function, these minerals can build up in the blood instead of being filtered out properly. When potassium levels rise too high, it can affect heart rhythm, muscle function, and nerve activity, potentially leading to dangerous complications such as irregular heartbeat, weakness, or even life-threatening cardiac problems. Phosphorus buildup can also cause serious issues, including weakening of the bones, joint pain, itching, and calcium imbalance in the body, because damaged kidneys cannot regulate these minerals effectively. Doctors often advise kidney patients to follow a controlled diet because even small dietary mistakes can have big health consequences, and pumpkin seeds, despite being natural, can silently contribute to these imbalances. People undergoing dialysis or living with chronic kidney disease are usually given strict dietary guidelines for a reason, and foods high in phosphorus and potassium frequently appear on the caution or avoid list, especially when consumed regularly or in large amounts. Another concern is that pumpkin seeds also contain protein and fat, and when kidneys are struggling, they are already working harder to manage waste products from protein metabolism. So constant consumption of heavy or nutrient-dense foods can place additional strain on already weakened kidneys. Salted pumpkin seeds make the situation worse because excess sodium contributes to fluid retention, swelling, and increased blood pressure, conditions that are already common in kidney disease patients and can increase the risk of heart problems. Some packaged pumpkin seeds may also contain additives, seasonings, or preservatives that add extra sodium and chemicals the kidneys have to process, further increasing stress on the system. Many people think that because pumpkin seeds are considered a healthy snack, they're automatically safe, but kidney health is different from general health, and what benefits one body can harm another depending on its condition. It is also important to understand that kidney disease is not always obvious in the beginning, and some people may be unaware that their kidneys are weakening while regularly consuming foods that are not kidney-friendly. Those who have been warned by doctors about high potassium levels, borderline kidney function, or abnormal kidney test results should think carefully before adding pumpkin seeds to their daily routine. Even if eaten occasionally, portion size matters because pumpkin seeds are nutrient-dense and a small amount already contains a concentrated dose of minerals that can affect blood levels. People who are diabetic are also at higher risk for kidney disease, and many of them turn to healthy snacks like seeds thinking they are safer. But if kidney function is already compromised, pumpkin seeds may still pose a risk. Individuals with hypertension, another leading cause of kidney problems, may also experience worsened fluid balance if they consume salted pumpkin seeds frequently, adding more pressure to both heart and kidneys. Children or elderly individuals with kidney issues should definitely avoid pumpkin seeds without medical approval because their bodies are often more sensitive to mineral overload. Anyone living with chronic kidney disease, undergoing dialysis, recovering from kidney injury, or instructed to follow a low potassium or low phosphorus diet should speak with a healthcare professional before consuming pumpkin seeds, rather than assuming they are harmless just because they come from a plant and are commonly promoted as nutritious. People who are trying to lose weight, control calories, or manage fat intake need to be careful with pumpkin seeds because, even though they are healthy, they are extremely calorie-dense and easy to overeat without realizing it. A small handful may not look like much, but those tiny seeds pack a lot of energy, and most people do not measure portions when snacking. Pumpkin seeds contain healthy fats, but fat is still high in calories, and when someone is already struggling with weight or trying to create a calorie deficit, these extra calories can quietly slow progress or even lead to weight gain if eaten regularly in large amounts. Many people add pumpkin seeds to salads, smoothies, yogurt bowls, and snacks thinking they are making a healthier choice. But when each meal is topped with calorie-dense seeds, the total daily intake increases significantly. For people dealing with obesity, overweight issues, or stubborn belly fat, foods that are concentrated in calories can make it harder to stay within recommended limits, especially when they feel so light and harmless that people underestimate them. Another factor is that pumpkin seeds do not create strong fullness compared to the calories they provide. It is easy to keep snacking without feeling satisfied, which leads to mindless eating. People on strict diets, intermittent fasting plans, or weight control programs often rely on snacks to feel better emotionally, and pumpkin seeds can become a habit snack simply because they are labeled as healthy, even though they can sabotage progress. Salted and flavored pumpkin seeds make the situation worse because they are often roasted in oils or coated with seasonings that add even more calories and unhealthy fats while increasing cravings. Sodium in salted seeds also leads to water retention and bloating, making people feel heavier, puffier, and discouraged about their progress. For individuals trying to control cholesterol or triglycerides, consuming too many fatty foods, even plant-based ones, can interfere with lipid management goals if their intake is not monitored carefully. People who have slow metabolism, hormonal weight issues, hypothyroidism, COS, or insulin resistance must be even more alert because their bodies already struggle with efficient calorie burning, meaning every extra calorie matters more. Many fitness or diet influencers promote pumpkin seeds as superfoods, which makes people believe they can be eaten freely without consequences. But weight management is about total energy balance, not just nutrient quality. Portion control is extremely important, yet most people rarely weigh or count seeds, leading to hidden calorie creep throughout the day. Another concern is emotional eating. Because pumpkin seeds are crunchy and comforting, people often snack on them while watching TV, working, or scrolling on phones, which turns them into unconscious eating patterns. Those following low-fat diets or medically supervised weight loss programs may also find pumpkin seeds conflicting with their dietary restrictions because of their fat density. Some people also experience digestive heaviness from fatty foods, which can slow digestion and affect how long they feel sluggish after eating, making exercise motivation harder. People who have joint pain or mobility limitations because of weight often try to reduce calorie intake as part of treatment, and regularly consuming calorie-packed seeds can delay the health improvements they are hoping for. Individuals recovering from heart problems or advised to reduce fat intake may also be instructed to monitor foods like seeds more strictly to prevent unnecessary lipid and calorie load on the body. Even athletes or gym-goers trying to cut body fat while maintaining muscle need to track what they consume, and pumpkin seeds, though beneficial in moderation, can disrupt carefully planned macros if eaten casually without awareness. People with high blood pressure, heart problems, or those who have been advised to reduce sodium intake need to be especially careful with pumpkin seeds because most people consume them in salted or heavily seasoned forms that can significantly increase daily sodium levels. While pumpkin seeds themselves are nutritious, the problem often lies in how they are prepared and packaged. Store-bought pumpkin seeds are commonly roasted with salt, flavored with spices, or coated in savory seasonings that may seem harmless, but actually contain large amounts of sodium. High sodium intake causes the body to retain water, which increases the volume of blood flowing through the vessels, forcing the heart to work harder and raising blood pressure. For someone already dealing with hypertension, this added pressure can worsen the condition, increase the risk of stroke, damage blood vessels, and put unnecessary stress on the heart and kidneys. Many people snack on salted seeds mindlessly while watching TV or working and do not realize how quickly the sodium adds up, especially when they consume large handfuls without measuring. Even lightly salted or roasted versions can still contain significant amounts of sodium, and flavored varieties like chili, barbecue, lemon pepper, or spicy mixes usually contain even more. People who already have heart disease, previous heart attack history, heart failure, or chronic cardiovascular conditions are often advised to strictly monitor salt intake because excess sodium can worsen swelling, fluid retention, shortness of breath, and overall heart strain. Blood pressure medications and heart medications can become less effective if someone continues to consume high-sodium foods, meaning salted pumpkin seeds can quietly interfere with treatment progress. Sodium also contributes to stiffening of blood vessels over time, which reduces elasticity and makes it harder for the cardiovascular system to function normally. Another issue is that many people pair salted pumpkin seeds with other salty foods throughout the day, such as chips, fast food, packaged snacks, and processed meals, making pumpkin seeds just another hidden source of salt that pushes them beyond safe daily limits. People who sweat less, have kidney problems, diabetes, or obesity are even more vulnerable to the negative effects of excessive salt because their bodies already face difficulty managing fluid balance. Children, elderly individuals, and people sensitive to salt may experience swelling in hands, ankles, or face after consuming salty snacks like pumpkin seeds, which is a sign that the body is retaining fluid. Some store-bought pumpkin seeds are also fried or roasted in oil, which adds unhealthy fats and calories, further increasing cardiovascular risk. People on a heart-friendly or low-sodium diet may mistakenly believe they are making a healthier snack choice because pumpkin seeds are often marketed as nutritious, but without checking labels, they may end up consuming something that works against their heart health goals. Even individuals who do not have diagnosed hypertension but have borderline blood pressure or a strong family history should be cautious because consistent high-sodium exposure can gradually push them toward chronic high blood pressure. Those who experience frequent headaches, dizziness, facial flushing, or unexplained tiredness after eating salty foods may notice their symptoms worsen when consuming salted pumpkin seeds regularly. People who are advised to reduce salt because of swelling in legs, water retention, or fluid buildup should strictly avoid salted varieties and be mindful of portion sizes, even if the seeds are labeled as roasted or healthy. Athletes or gym-goers sometimes consume salted seeds for taste, but if they also struggle with blood pressure or heart health, this habit can still be risky. Individuals living in hot climates or who sweat excessively sometimes believe extra salt is helpful, but for those with hypertension, uncontrolled sodium intake remains dangerous regardless of temperature. Reading nutrition labels, choosing unsalted varieties if necessary, and understanding that not everything marketed as healthy supports heart health is crucial for anyone dealing with high blood pressure or cardiovascular concerns.